A flawed behavioral health EHR implementation can impact your revenue cycle, damage provider relationships, and even risk federal fines for substandard record keeping. Too many EHR providers overcomplicate the process and drag the transition on for weeks or even months. Here is the implementation checklist for a behavioral health EHR, what it takes to bring a new system online without the months of frustration. We walk through choosing a specialized system, communicating the why, building a transition plan, securing training, and rolling out in stages. Bringing a new EHR online is more than a record-keeping update. It is a major cultural shift for your whole organization. Understanding the difference between an EHR and an EMR is an important first step before you begin. Switching to a new EHR is a major investment in the quality of care your organization provides to patients. A flawed implementation can impact your revenue cycle, annoy your patients, and damage your relationships with other healthcare providers. If your EHR implementation goes poorly, you even run the risk of receiving fines from the federal government for substandard record keeping. Many EHR providers overcomplicate the process, dragging a transition out for weeks or even months. Behave Health's EHR is specifically tailored to addiction treatment, and the workflows common to outpatient, residential, and detox facilities are already configured and ready to use. Choosing a specialized system is designed to let you skip the long adaptation period a general healthcare EHR would need for behavioral health. Behave Health says it can train your team in 3 days in person or 5 days over the web, with individual sessions generally wrapping in 1 to 2 hours. 5 steps separate a smooth implementation from a painful one. Let us walk through each one in order. An easy implementation rests on 2 things: a well-designed EHR and a well-supported transition. Step 1. Choose a system built for your industry. Don't reinvent the wheel. A behavioral health provider shouldn't share the same software as a dentist, a physical therapist, and a cardiologist. Their needs are completely different. Avoiding systems that aren't tailored to your industry lets you skip the long, painful adaptation by an implementation team that may not understand your workflows. Step 2. Focus on the patients and communicate the why behind the change to your whole team. Executing a major change is much easier when everyone understands why it is being made. Emphasize patient engagement, outcomes, privacy, and easier billing. Take a baseline measurement of the key performance indicators you expect to improve, then report back with proof of your return on investment. Step 3. Don't implement without a solid transition plan. If possible, assemble an implementation team, or at least designate an implementation project manager, and choose an implementation date. Advise all staff of the process well before implementation day, and model a positive can-do attitude toward the change. Step 4. Make sure your EHR provider offers ample training opportunities. Training can be tedious or fun. It depends on how well your EHR was designed and how well it suits your organization. Behave Health says it designed its product to be self-explanatory and easy to use from day one, even for people who don't consider themselves techies. Step 5. If you're hesitant, consider implementing your EHR in stages rather than all at once. Identify staff who thrive with new technology and let them test drive the system before the full rollout. Designating EHR super users can generate excitement for the switch and build in-house capacity for informal training and ongoing optimization. Run the checklist before you commit to a platform. These 5 steps decide whether your rollout is smooth or painful. Pick an EHR built for behavioral health, so workflows are configured, not adapted after the fact. Communicate the why to your team, build a transition plan with a named owner and a date, and secure ample training. Where you're hesitant, phase the rollout and lean on super users to build momentum and in-house support. An easy implementation rests on 2 things: a well-designed EHR and a well-supported transition. Behave Health is designed to deliver both. Outpatient, residential, and detox workflows come already configured, designed to remove the custom adaptation a general EHR requires. A quick start process is designed to train teams in 3 days in person or 5 over the web, with sessions generally wrapping in 1 to 2 hours. The product is designed to be self-explanatory and easy to use from day one, even for staff who don't consider themselves techies. Stop letting a flawed rollout threaten your revenue cycle. Book a free demo of the Quick Start implementation at behavehealth.com. See the pre-configured behavioral health workflows and Quick Start training at behavehealth.com.